Imagine watching TV and a heart-wrenching commercial flashes the screen of a child in a pediatric hospital with doctors surrounding them not knowing what's wrong. Doesn't your mind wander? My reaction is one that tugs at the heartstrings, especially now that I have a godson. Vaccinations are extremely important and everyone should talk to a doctor about them. Today I want to tell you why children should be vaccinated. In order to influence your opinions on vaccinating children, we will first discuss why vaccinating children is important, then the risk of exposure to those diseases that have been eradicated, and finally, the impact on future generations. First, we will discuss why vaccinating children is important. Vaccinating is important because children need protection early. In fact, a chart found on a federal government website managed by the U.S. Department of Health and Human Services and last updated February 1st of 2016 shows that at birth, infants get one vaccine, the first dose of hepatitis B. In addition, the Center for Disease Control, or CDC website, states in an article last updated August 15th of 2016 that there are 14 serious diseases that your child can get if not protected early as babies. The article further explains that in order to be fully immunized, children need all doses of the vaccines in the recommended schedule set by the CDC. In fact, the CDC article clearly states that not receiving said number of doses leaves a child vulnerable to catching those serious diseases, such as human papillomavirus and hepatitis A and B, according to an article found on the National Foundation for Infectious Diseases. Vaccine ingredients are carefully reviewed by scientists, doctors, and healthcare professionals, according to another federal government vaccine article. From experience working at a pediatrician's office, there's no way of knowing the immediate impact it will have on your child, but serious reactions are very rare. According to the same vaccine article, the disease prevention benefits of getting vaccines are much greater than the possible side effects, like an allergic reaction for all children. According to an article last reviewed April of 2015 from the federal government website, getting vaccinated is actually an easier process when you know what to expect from the visit. For example, the article directs parents to the vaccine information statements for questions concerning vaccinations and possible side effects, such as soreness of the injection site or a fever. Lastly, this article makes sure to say once again that serious reactions to vaccines are very rare. Now that we understand why vaccinating children is important, we can move on to the risks of eradicated diseases. There is a risk of exposure to previously eradicated diseases in the United States, and vaccines makes the difference in cases like this. For example, polio was once one of Americans' most feared diseases, causing death and paralysis across the country, according to an article published by a government vaccine website. But today, thanks to vaccination, there are no reports of polio in the United States. However, some diseases such as the measles are at risk once again. According to an article from the Time magazine website, last reviewed on March 17th of 2014, there were as many as 19 cases reported that year. In fact, the article also states that if you are unvaccinated and come in contact with the measles, there is a 90% chance that you will get it. Even closer in date, an article from the CDC website last updated June 27th of 2017 states that between January 1st to June 17th of this year, there were 108 cases of people reported having the measles. Now, simply getting the MMR or MMRV vaccine could lower these numbers dramatically because the measles is an airborne disease. Also covered by the MMR or MMRV vaccine is another disease known as the mumps. An article from the CDC website, last updated May 29th of 2015, defines mumps as a contagious disease caused by a virus that can spread through saliva or mucus from the nose, mouth, or throat. Also, an article from the USA Today website from the CDC, last updated March 10th of 2017, says that hundreds of cases have been reported across the country since 2017 began. Over 1,000 of those cases of the mumps were reported as of March this year. Many of the cases from 2017 were a continuation from the previous year, where over 5,000 cases were reported, marking the highest number of cases in a decade. The article concludes, the most important thing is to be sure your child has 2 dosages of MMR and avoiding the obviously ill. Beyond that, it is really difficult to prevent this because, again, people are in closed settings like a classroom, and it is very contagious. Bringing me to my next point. After understanding why vaccinating children is important and learning the risks of exposure from those previously eradicated diseases, we can finally discuss the future impact of vaccinations. Vaccinating saves the lives of future generations. According to the article by the U.S. Department of Health and Human Services on a government website, vaccines have reduced and in some cases eliminated many diseases that killed or severely disabled previous generations. For example, the smallpox vaccination eradicated that disease worldwide, and now your children do not have to get that vaccination. The article further explains that by vaccinating your children against rubella, or German measles, that risk decreases for pregnant women. An article from the National Foundation for Infectious Diseases website makes a note that vaccine-preventable diseases are more serious for the very young and very old. So, when a child gets vaccinated, the child's family is being protected as well as the community, according to a CDC article last updated August 15th of last year. In addition, diseases do not stop at the border and can be carried back into the U.S. if not already here. For example, as I mentioned earlier, measles is now occurring among the U.S., and the CDC article explains that measles is still common in other parts of the world. So, measles is being brought back by those that are unvaccinated, whether they be travelers or visitors infected while abroad, spreading quickly to those not vaccinated. It is clear to me that by increasing the number of vaccinated children and people, we are decreasing the amount of overall cases each year. So, as the government vaccine website states, if we continue vaccinating now and vaccinating to the full extent, parents in the future may be able to trust that some diseases of today will no longer be around to harm their children in the future. Today I have explained why children should be vaccinated. We discussed why vaccinating is important, the risk of exposure to previously eradicated diseases, and the impact on future generations. By taking the time to vaccinate your children, you are continuing the growing list of eradicated diseases and furthering the health of others. So be proactive and knock out those germs one at a time.